contain comprehensive information related to the care provided pursuant to the 911 call in response to 100 North Carrollwood on June 25th?
Yes, it does.
When did you complete this document? Are you the author of it?
I am the author.
And when did you complete the information contained on this document?
After the call was complete.
Your Honor, may I have the lights, please?
Thank you. Yes.
May I approach?
Certainly.
I'd like to go over just some of the information with you generally on this document. Is the information concerning the times of the administration of the starter drugs contained in this document starting 9 through 12:50?
Yes.
And the information concerning the responses of the blood pressure, pulse, respiration, and so forth, the readings that you provided to us, they're also contained here in this document, correct?
Correct.
Did you also record the information concerning the medication information provided to you by Dr. Murray on the Form 902, as well as your own notes contained on Exhibit number 43?
Yes.
After UCLA base at 12:57 indicated that they were prepared to call time of death, what efforts continued within the bedroom area?
Well, at that point, we knew we were going to be transporting, so some time would elapse, so we gave some sodium bicarb.
Sodium bicarb to Mr. Jackson?
That's correct.
As a result of giving Mr. Jackson sodium bicarb, was there any change in his condition?
No, there was not.
Were there any other efforts or medications provided to him prior to transport?
No. No.
When Mr. Jackson is transported, is he taken from the upstairs bedroom downstairs on a gurney or a backboard?
On a backboard type device.
Who takes Mr. Jackson down from the bedroom, down the stairs on the backboard?
All of us that were there.
Describe who you mean by all of us.
I mean our fire captain, our firefighter, and paramedics Goodwin, Blunt, and myself, and Engineer Brigandy.
Presumably, some of the fellows are carrying the backboard, maybe two on each side.
That's correct.
Are there also resuscitative efforts being conducted as Mr. Jackson is being carried down the stairs from his bedroom?
That's correct.
Describe those efforts, please.
Well, when we're carrying him on the stairs, right up into the stairs, you can still do CPR, but it's not possible to really do CPR on the stairs. So that stopped. We're carrying him down the stairs, but at the same time, he's still being ventilated with the bag valve mask device through the...
Once you get down to the foyer area of the residence, is Mr. Jackson then transferred from the backboard to a gurney with wheels?
That's correct.
Once Mr. Jackson is transferred to the gurney, what do you do next?
I turn around and go back up to the room to get our equipment.
When you return to the bedroom, do you see Dr. Murray?
Yes, I do.
Describe for me what you see Dr. Murray doing when you return to the bedroom.
He has a bag in hand, and he's picking up items from the floor.
Where is he located when you see him with the bag in his hand picking up items from the floor?
Near the nightstand.
On the far side of the bed?
On the far side of the bed.
lights, please?
Thank you.
Thank you. Mr. Senneff, I'd like to direct your attention to an exhibit previously marked as People's Number 23. Does this photograph permit you to show the area where you saw Conrad Murray located when you returned to the bedroom and he was picking up things off the floor and putting them in a bag?
Yes, it does.
Would you use the pointer, please, and so indicate?
He was standing in this area right here.
May the record reflect the witness is indicating the area which would be on the far side of the bed between the side of the bed and the white chair.
Yes.
Mr. Senneff, I noticed in this photograph there appears to be there is a blue object or area. Do you see that?
I do.
What is that?
That is a blue ambu bag.
Is that one of the ambu bags that you used or your team used to try to resuscitate Mr. Jackson?
No, ma'am.
When you were retrieving the items that you all had used, I'd like to ask you to look at People's Number 21. Does this photograph allow you to show us where you were located when you were in the bedroom and you made the observations of Dr. Murray near the bed, by the nightstands, picking up items?
It does.
Would you use your laser pointer to so indicate, please?
I was standing approximately right here.
May the record reflect the witness is indicating the foot of the bed on the carpet closest to the far side of the bed near the red chair. Is that accurate, Mr. Senneff?
That's accurate.
Thank you. After you retrieved your items, what did you do?
Lights back on?
Yes, thank you, Your Honor.
Went back down the stairs to the ambulance.
When you turned and left the bedroom, was Dr. Murray still in the bedroom?
Yes, he was.
Did you then go down the stairs, exit the residence to the ambulance area?
Yes, I did.
At some point after you were at the ambulance area, did Dr. Murray join you in the ambulance? Join you in the area near the ambulance?
Yes, he did.
At this point, is Mr. Jackson loaded into the ambulance, ready to go?
Yes, he is.
Did you and your team then transport Mr. Jackson to UCLA Medical Center?
Yes, we did.
When you left the residence, where were you located inside the rescue ambulance?
I was seated in the jump seat, which is at the head of the gurney.
So you are closest to Mr. Jackson's head?
That's correct.
Who besides you was in the back of the ambulance?
Paramedics Goodwin and Blunt.
Anyone else?
Dr. Murray.
You are able to make observations of Mr. Jackson's physical condition being right by his head, correct?
That's correct.
Were his eyes still fixed and dilated?
Yes, they were.
Was his skin still tinged blue, meaning cyanotic?
Yes, he was.
Was he still hooked up to a heart monitor?
Yes, he was.
Were there any signs of heart activity displayed to you during the transport of Mr. Jackson's body to the hospital?
No, there were not.
Was Mr. Jackson given additional drugs, starter drugs, to attempt to revive him in the ambulance?
Yes, he was.
What medications was given to him?
Epinephrine and atropine.
Did those drugs produce any change in Mr. Jackson's condition?
No, they did not.
Did you observe Dr. Murray undertaking any activities in the back of the ambulance unrelated to Mr. Jackson's care?
Yes, I did.
What did you observe?
He answered his cell phone.
Did he answer it or make a call? Or do you know?
I don't know.
But you saw him on the phone.
I saw him talking on his cell phone.
Was there any change in Mr. Jackson's condition from the time that you arrived at his location at 100 North Carrollwood at 12:26 p.m. until the time that you and your team transported Mr. Jackson from his residence to UCLA Medical Center?
No, there was no change.
Did you ever see any sign of life in Mr. Jackson during the entire time that you were attempting to save him?
No, I did not.
When you arrived at UCLA emergency room, was that at 1:13 p.m.?
Yes, it was.
Total, you were with Mr. Jackson for approximately 42 minutes. Is that accurate?
Yes.
Any sign of life at all during any of those 42 minutes?
No, ma'am.
Thank you, Mr. Senneff. I have no, excuse me. One moment, please, Your Honor.
Sure.
Thank you, Your Honor. Mr. Senneff, I have a couple of additional questions for you. You told us that there was no medical equipment in the bedroom area where Mr. Jackson and Dr. Conrad Murray were located. Specifically, did you see an EKG or an ECG machine?
No, I did not.
Did you see any type of heart monitor?
No, I did not.
Did you see any type of capnography machine?
No, I did not.
You told us that Dr. Murray advised you that Mr. Jackson was a healthy male, he had no underlying health condition, and that Dr. Murray had administered lorazepam to him, correct?
That's correct.
And he was treating him for exhaustion and dehydration, correct?
That's correct.
Did Dr. Murray ever mention to you having administered propofol to Michael Jackson?
No, he did not.
Did Conrad Murray ever mention the word propofol to you during the time that you were at the location or in his presence?
No, he did not.
At no time he mentioned propofol, correct?
No, ma'am.
Double negative.
He didn't. He never mentioned the word propofol.
Thank you.
And when you left the bedroom after retrieving your items, was Conrad Murray alone in the bedroom?
Yes.
Thank you. I have nothing further.
Ms. Brazil, thank you. Cross-examination, Mr. Gorgia.
Thank you, Your Honor.
Thank you.
Good morning.
Could you panel cross from the
Absolutely, Your Honor.
podium, please? Thank you.
Mr. Senneff, just to clarify, when you first got the call to respond to Carrollwood, what time was that at?
When I first got the call at the station, it's 12:22.
12:22. And what was the dispatch time?
12:22.
And are you aware, as you sit here today, that the 911 call was placed at 12:20?
I know that's 12:21.
The 12:21 that you're referring to on the teletype, isn't that when the Beverly Hills transferred the call to Los Angeles, the call center?
I do not know.
Okay, so you would agree that the Beverly Hills Police Department record would probably be more accurate, is that correct?
Objection, lack of foundation.
Sustain.
But as you sit here today, are you aware that the 911 call was placed at 12:20?
I'm not aware of
Lack
that.
of foundation.
Overruled. You may answer it.
Okay. I don't know exactly what happens when you pick up your phone and who it goes to and when you're in Beverly Hills.
Okay, are you aware that when the 911 call was placed at 12:20,
Objection states the testimony.
That does. It assumes that's not in evidence. Sustain. You may re-ask.
okay, are you aware when somebody in Beverly Hills calls 911, it gets sent to the Beverly Hills Police Department?
No, I'm not aware of that.
Okay, are you aware that after the call is placed to the Beverly Hills Department, the call then gets transferred to Los Angeles Call Center?
Yes.
Okay, and then from there, the call is then transferred to Fire Station 71, correct?
Yes.
Okay, and that call came in at approximately what time?
12:21 or 12:22 at our station.
Okay. Now, when you first got the call to respond to Carrollwood, at that time, you didn't know this call involved Mr. Jackson, correct?
Correct.
The ad was that this was a 50-year-old adult male in cardiac arrest.
That's correct.